Hi, my name is Dr. David Thomas. I'm an employee here at Cadence Physical Therapy for about 2 years now. Today I'm going to take you through some introductory exercises that focus on using the core to stabilize the spine while also addressing dysfunctional movement patterns and pain. So today we're going to go through 3 techniques. I'm going to teach you 4 things. So first thing I'm going to talk to you about is about pillar stabilization, and then we're going to go over 3 exercises. So what is pillar stability and what does it do for anybody, right? So pillar stability is the use of the deep core muscles, one of them being called the transverse abdominis. It's a corset muscle that wraps around the entire spine. I want you to think of it as like a weightlifter's belt or a corset that they would wear in Renaissance times. We essentially have a muscle that does that same function for us. So we need to start recruiting that in most of our functional activities, whether we get out of bed, rolling towards your side, squatting up and down. So I'm going to teach you how to use that technique. So firstly, how we do that is with almost every strengthening or stability exercise we do, we have to draw in the belly button. So simply just drawing in the belly button is going to help activate some of those core muscles. It's important to use that cue of pulling in the stomach like you're taking a photo, an Instagram photo perhaps. We want to use that muscle and activate that, pulling that abdominal wall in whenever we're getting in and out of bed, squatting out of a chair, even going for a walk. Things like that are going to help protect you from back pain and going to help you maximize the stability from the spine that we naturally have. So I'm going to help you use that technique to address things. Firstly, one exercise for any shoulder or neck pain. Then we're going to move on to an exercise for anything from lower back to down the hips to the knees and ankles. And then finally, I'm just going to teach you one exercise that's designed just for core and balance. So the first one we're going to do is a corrective shoulder neck pain activity. So this is something that you can do easily at home, laying on your bed. If you want to lay on the ground on a yoga mat, that's also fine too. What we're going to do is I want you to first, we're going to lay on your back. Okay. So one thing that's important here too is many people can have some back pain. If you have a history of back pain with your legs straight, this could cause some extra stress on your lumbar spine. So what we're going to do simply is we're just going to bend both your knees just to be safe. Okay. So what I have here is a TheraBand loop. You can get these on Amazon. You can pick them up at our clinic if you'd like. I'm going to go over one of the corrective shoulder and neck and thoracic pain corrective exercises. So we're going to want to use that core recruitment activity exercise that I taught you. I want you to pull in your belly button like this. So you don't want to be pushing your abs out like this. Many times I see that issue happen when people I'll tell them to activate their transverse abdominis to get those deep stabilizers working. Many people will think about pushing their stomach out. If you're doing that and you can feel your outer abdominals, you're doing it wrong. You want to pull the abdominal wall opposite. You want to go in, and you want to be breathing while you're doing that. So now that I've got my transverse abdominis activated, that's going to help protect my spine along with my knees being bent to this degree. We're going to start with the loop wrapped around our wrists here. Palms will be facing each other. We're going to start like this with the belly button pulled in. We're going to have our arms going outwards. And you want to keep this tension. This is going to help protect you from any chronic front shoulder pain. It's going to help you recruit your scapular stabilizer muscles. So belly button pulled in, arms out, giving that tension, which we always want to keep throughout the whole movement. You're going to want to push your neck vertically down into the pillow gently. You're going to come up, and you're going to come back. You're going to come up, and then you return to the starting position. So one thing I want you to notice, if you get to a certain point and you start feeling some shoulder pain, we want to cut you shy of that range of motion. So discomfort is good, pain is not good. If it's uncomfortable, that's fine. If you're getting a true increase in pain, we're going too far back. So I want you to cut that just short of that painful range. We always want to be working in a pain-free or pain-tolerable range of motion. So again, belly button pulled in, come out wide, neck pushing back into the pillow vertically down, and we come back and forth. So how many repetitions can we do this for? We can do this anywhere between 10 and 15. 10 is going to be geared a little bit more towards strength, while 15 is going to be more for correcting dysfunction and getting that repetition in there to kind of hone in the proper body mechanics. So that one was for shoulder, neck, and thoracic spine pain. Next, I'm going to move on to one for the lower back and the lower extremities. So what I've got here is a gait belt. For all specific purposes, I'm sure not everybody at home has a gait belt. So anything that you can use at home, simply using a regular belt will do just fine as well. I'll explain the purpose of this in just a second here. So what we're going to want to do next is we're gonna get into that starting position just to help protect the spine in case you have any back pain. Knees bent. I'm gonna put this belt wrapped around my knees just above the knee joint. Okay, so what we're gonna do here is, again, we're gonna use that pillar stability. And pillar stability, I forgot to mention, what we're trying to achieve here is centration of the shoulders into their sockets, centration of the hips into their sockets, and belly button pulled in. That creates a very stable core and minimizing any chronic pains that you have throughout the spine. So what we're gonna do next is we're gonna do what's called a bridge. So again, the proper setup, belly button pulled in, always wanna do that. We're gonna wanna push outwards against that belt isometrically. So this is an isometric hip abduction activity. This is gonna work those pelvic stabilizers. So if you have any issues with balance, you have hip weakness, chronic back pain, many times there's a lot of hip weakness. So this is why this is gonna be a great cue to also get that centration and also get that core stability. So belly button pulled in, knees out towards the sides, and I want you to think about keeping your toes pulled up gently, driving through your heels as you lift up off the table. Belly button pulled in, pushing out, toes up, push through your heels. Feel that contraction for a good 2 to 3 seconds, and come back down. Now, many of you might be getting pain when you're bridging from a flat surface like this, so a little bit of a trick at home. If you have a couch with an elevated armrest, I'm going to try to simulate that here. All you simply have to do to reduce that strain on the back and put more emphasis on the glutes and hamstrings, which many people are actually quite weak in, we're going to elevate our legs. So elevating the legs not only takes more stress off the back, but helps you engage some of these, what we call the posterior chain, where most people have a lot of weakness. Most people have a quadriceps and lumbar extensor dominant movement patterns, and so that creates a lot of knee pain, ankle pain, back pain. So, again, knees flexed, belly button pulled in, toes pulled up gently, and we're gonna have you drive through your hips and push outwards. So even now in this position, I feel more of a contraction through my hamstrings and through my glutes, which is kind of what we're going for. And again, repetition-wise, we can anywhere from 10 to 15. If you fatigue before 10, that's okay. If you can make it up to 15, great. Okay, so again, that was for addressing some back pain, leg weakness. Next, I'm going to show you one that we can do just for the general core next and for balance.